Hi nurses, this is Dr. Bhupesh from Dr. BKM Institutes. I'm just going to record another video. At the end of this video, there is a thumbnail where you can click. We have recorded one special video for writing, reading, and speaking. Speaking again, I was telling that you have to speak in English. There is nobody in this world who will not learn speaking if somebody is trying. Suppose you will be very slow in the start. Please give me pencil. Or you are asking the patient, how are you feeling? Good morning, my name is Bhupesh. I am a nurse over here. How may I help you? Okay, what brings you here today? It's very simple. You just have to practice. When we don't practice, it looks speaking to is the easiest thing in the world. Anybody can learn. If you are talking in Punjabi or Hindi or in your regional language, how would you learn? So please don't blame anything else. Please, it's your practice that actually matters. So you have to practice a lot. Please. Please practice a lot and a lot. Now, the thing that we wanted to discuss about the writing. Today there was a letter which normally comes very often in OET exam that a patient is going to his her own doctor. That means doctor is there, you are writing to family doctor of the patient or you are writing to the patient's doctor. It is given in the last. Write a letter to Miss Suzanne Matthews GP. That means Suzanne Matthews GP. That means Suzanne Matthews doctor. That means this doctor already knows everything about Suzanne Matthews. So normally when we are OET trainers, we teach you that you should write in the second paragraph, as you know that the patient is having diabetes. So during hospitalization, diabetic diet was given. So we try to make a very good line, which is excellent. When there is a chronic condition, obviously doctor knows about it. So you say, as you know, the patient is diabetic. So during hospitalization, diabetic diet was given. Wow, excellent. Nice. But now today's letter was like patient fell. He was admitted to a hospital. There he was given 10 sutures were applied. He was given treatment. Then he was referred to our community center. We are the community nurses. So after taking our services, patient got better. Now we are sending the patient to an outside nurse who will take care. Oh, now we are sending the patient to patient's GP. We are referring the patient to patient's GP for the mental health and other well-beings. It's very simple. What will happen in a foreign country? Patient will have a problem. He will go to GP. GP will refer the patient. Then patient will take the treatment. Then we will provide the treatment being nurses. Then patient will again go to GP for the normal care. It's very simple. It's not tricky at all. Now, the problem in this letter was patient fell, he went to the emergency department. It is not given whether the patient informed the GP or not. He fell and he went to the emergency department. Now, we can't write, as you know, that the patient fell. Very important. I'm telling you small things. These are the small errors people do. So in this kind of letter, don't write, as you know, the patient fell, so 10 sutures were applied. No, 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 no. Maybe he did not inform the GP. Maybe GP does not have any information. So please don't do that. So again, when you're writing even complex letter like this, make it simple. This letter is being written regarding your known patient, Miss Matthews, who fell and went to an emergency department. There she was provided the treatment and then was referred to us for the community services. After taking our services, she is better, but she still has some concerns regarding her mental health, this, and wait. Therefore, being her GP, you are requested to provide her the required care. Required care means whatever is required now, you provide the care. Listen to it again and please take a pencil and a notebook and write it. This is a very important letter that repeats because patient is not coming to our emergency department. Patient is going to an emergency department. Then the patient is referred to us. So there are two stages in this letter. So this letter is being written regarding Mrs. Matthews, who fell and was admitted to an emergency department. There, she got the required treatment. and then referred to us for the community services. Full stop. After taking our services, she is better, so she is being discharged. Or if rather discharge word is also not good, community center might not admit the patient. So um, she is better now. Full stop. Sorry, discharge word. No, no. See, the small mistakes even I can do, but please, full stop. She's better now. Full stop. Now she's concerns, she has concerns or she is concerned. इसके साथ concerned, has के साथ concerns. She has concerns regarding her mental health, weight and height, or whatever three words are given, pick it from there. Full stop. Therefore you are requested, or therefore being her GP you are requested to provide her the follow-up care. So that is how you write it. Again, there is nothing complex. Small words do not matter, but kahani kaise bana? It's a story. So you have to act like nurses. Then the second paragraph, don't explain over about the emergency department. You say, in hospital or in emergency department, 10 sutures were applied and one or two lines, this statement was given. Otherwise, lot of things would be given, lot of data would be given. Don't get carried away. In emergency department, 10 sutures were applied and required treatment was given. During our care, this was given, that was given, this was noticed, she was recommended to have meals on wheels, she started taking meals on wheels, so overall her condition is better. However, now she has concerns regarding these three things, and being her GP, you are requested to provide her the required care. That's it. Don't make letter complex. Every data is not important, because now data is only this thing: mental health, height or weight, whatever is given. उसके अलावा कुछ भी इंपॉर्टेंट नहीं है इस लेटर में। ट्रिकी लेटर है, तो आपको जान के बहुत बड़ा लेटर देते हैं कंफ्यूज करने के लिए। सो डोंट गेट कैरिड अवे, स्टिक एंड फोकस टू द पर्पस। इफ पर्पस इज राइट यू विल पास। Even if you want to make it more easy, you can do, this letter is being written regarding Matthews, who is concerned. This letter is being written regarding your known patient, Miss Matthews, who is concerned about her height, weight, and this. And being her GP, you are requested to provide her the required care. Even this paragraph is fine. Then in the second paragraph, you can say, on this date, she fell and she was admitted to an emergency department. N word is very important because it's not our emergency department. On this date, she fell down and she was admitted to an emergency department. There she was, their word is also, there she was given that and that thing. Third paragraph, then she was shifted to our hospital, our community services. This was given, that was given, passive voice, this was given, that was given. And then the final paragraph, now she has concerns regarding this, and being her GP, your expertise or your care for the patient would be highly appreciated. In these kind of letters, sometimes you can avoid this too, that would be highly appreciated, because obviously uh, he's family GP, so he would also be concerned. But it's not a bad line. But think wisely. Think you are in a practical situation, then you will get the right ideas. Behave like a nurse when you are doing writing and speaking. Your work will become 10 times easy. Don't think you are taking OET exam. Think you are a nurse. You have got data. You have to send the patient to someone. So give the required data, which is what is important. Like if you're writing to orthopedician, don't write anything regarding eyes. If you're writing to an ophthalmologist, don't talk about bones. You all know, we all are medical professionals. So there is nothing to worry. Just focus, behave like a nurse. And speaking, please speak in English. That's it. You automatically will pass. Writing and speaking are very easy. Reading, you have to focus, learn elimination method. And now I'm attaching a video. Subscribe the channel for more videos and click on this thumbnail for what we have covered in the last video. Thank you very much. This is Dr. Bhupesh once again. Thank you.